we are at a very, very critical moment in work on LGBT aging issues. Some of that's about numbers. And as you can see in the slide here, the number of Americans who are 65 and older is increasing dramatically. One way to think about that is that there was a time when the age spread in this country looked like a pyramid with a very, very, very small slice of people who were 65 and older at the top. If you fast forward to where we are now, look at how this changes. Look at how these numbers look different. In 2000, what we see is we don't see a pyramid anymore, we see a bottle. In 2030, by 2030, we see the number changing more and more and more. We are approaching a time where people 65 and older will be more than 20% of the population in this country. And that has huge, huge implications for the LGBT community. Because, the fact is that those who are in charge of aging policy, those who are in charge of aging services in this country, those who are in charge of creating products for older people in this country, frankly have basically ignored the fact that LGBT older people exist. And to be honest, I don't know that our community has been that much better when it comes to paying attention to the needs of older members of our community. So we are very, very unprepared for this demographic, what some call a demographic tidal wave. So some of this is about numbers. Some of the reason why this work is so important at this point in time is about numbers. But some of it is also about opportunity. And the fact is, as Louis mentioned, we've had the great honor in recent years to build SAGE with the help of philanthropists and the help of foundations, to build SAGE and our network so that we are increasingly becoming a force to reckon with in aging advocacy in this country. We're also at a moment in time when we have a White House and a U.S. administration on aging that is quite interested, finally, in focusing the federal government on the needs of LGBT older adults. And that couldn't come a moment too soon, and it makes a huge difference because the reality is that the federal government is the key player when it comes to aging in this country. Every year, the federal government pumps $1.5 billion into local services for older people in this country. Of that $1.5 billion, less than $1 million goes to programs that are targeted for LGBT older people. So if we can change the way the federal government approaches aging, if we can write LGBT people into the federal vision of aging, we can have a huge, huge difference. We can make a difference, and we believe that we can. We believe that we can do that. So it's about numbers, and it's about opportunity, but it's not even just that. There are other reasons why it's really, really important that we focus our efforts, our collective efforts, on the interests and needs of LGBT older people. Some of it is about economic hardship. The reality is the work on LGBT aging issues is about basic needs. It's about making sure that every member of our community has the opportunity to have their basic needs met. And what we know is that LGBT older people face significant economic hardship as they age. There are a number of studies that show that as we get older, we are more anxious, we're more stressed out about our later years than other older people in this country, and there's a reason for that. The reason for that is that we basically stand on shakier ground, both financially and otherwise. So LGBT elders face higher poverty rates than elders in general, and that is particularly true among older lesbians. It's also particularly true among LGBT elders of color, and it's particularly true among transgender elders. This is the result of a lifetime of discrimination. We all know this. We know that we face discrimination in the workplace, which means that wages and salaries and promotional opportunities are suppressed over an entire lifetime. We face discrimination in retirement plans and in benefit plans and in the federal safety net that doesn't recognize our relationships, all of which adds up to higher poverty rates. But it's not just poverty, as important as that is. These impacts are up and down the income ladder when it comes to differential and discriminatory treatment in the tax structure, in the ability to inherit, etc. So this is about economic hardship during what are already very difficult economic times. It's also about isolation. In our country, more than 80% of the long-term care needs of older people are met by spouses and by adult children. Well, those folks are largely absent for the generation of LGBT older people that SAGE is serving. We are twice as likely as we age to age as single people, and we are 3 to 4 times as likely to have no children. So the support network that exists to a greater or lesser degree for older people in this country is largely absent for us. And that leads to tremendous challenges in terms of long-term care. But it's not just about long-term care, it's about isolation, it's about the inability to feel part of a community. We build families of choice over the course of our lives. I think our community has a great tradition in doing that. But as we age, those families of choice often fray, especially if we live to a ripe old age and may outlive many of the members of our families of choice. So that is a serious problem. And what that leads to, among other things, is the fact that LGBT older people have a greater need for services than elders in general. But what does that look like? Unfortunately, while we have a greater need for services, in fact, we have a harder time finding them. The so-called mainstream aging network has not been particularly good and particularly effective at serving older members of our community. There's a lack of sensitivity, there's a lack of knowledge, and I hate to say it, but in many cases there's downright bias and discrimination that we have to deal with. So what that means in many cases is that LGBT older people avoid accessing services, avoid going to their local senior center, avoid going to the places they need for support because they're afraid of the treatment that they're going to receive, or if they do go, they feel that they have to go back into the closet, which is obviously, as we all know, a humiliating experience after a lifetime of making our way out of that closet. So the lack of services is a critical problem, and here again, the federal government is the primary payer for services for older people, all of which leads to worsened health outcomes. We know that LGBT older people get less medical treatment than older people in general. Part of that is about fear of finding sensitive medical providers. We know that there are health disparities that lead to higher rates of diabetes, higher rates of alcohol abuse. We also know that particular subpopulations of older folks face especially difficult circumstances. Again, transgender elders and LGBT elders of color. So these are the reasons: numbers, opportunity, hardship, economic challenges, isolation, and lack of services. These are the reasons why we're here, why we do the work we do, and why this is such an important focus right now. But so what are we going to do about that? There is something very important happening right now. We have the opportunity to make this a transformational moment for LGBT older people. That $1.5 billion that the federal government spends, that isn't just passed out willy-nilly in this country. Those dollars are distributed through something called the Older Americans Act, which is a piece of federal legislation that is up for reauthorization in 2011. If you read that act, you will never see the words lesbian, gay, bisexual, or transgendered mentioned anywhere in the hundreds of pages that exist in that act. We need to change that this year, and we have the opportunity to change that this year. Last fall, SAGE convened a conference called The Future of Aging is in Our Hands, and we brought together a panel of experts to develop a strategy to make the change we need with the Older Americans Act. And we know what we need to do. We have a roadmap for that. The Older Americans Act talks about elders with greatest social need. We need to make sure that act specifically says that LGBT older people are among those elders. That's one thing we need to do. A second thing we need to do is we have to write the existence of the National Resource Center on LGBT Aging into the Act itself. As Lewis described, the creation of that center by the federal government was a huge step forward. But its continuity, its sustainability, its success cannot depend on who's sitting in the White House. It needs to be enshrined in the Older Americans Act itself. We need to bring LGBT issues front and center in the National Aging Network. There's a reason why we've already seen AARP up on this screen twice today, even before we got to the stage. They make a huge difference, and other organizations like them make a huge difference. So we have to work with them to lift up our issues. That's why SAGE has been building a partnership with AARP, why they were the lead sponsor of our most recent national conference. It's why we worked really hard to become the first LGBT member of the powerful Leadership Council of Aging Organizations, and it's why we're working with a number of national people of color organizations to create a diverse elders coalition. We know that to make transformational change, we're not going to do it alone. That's impossible. We have to work with other folks. We have to get our allies and our friends to step up to the plate on LGBT aging issues, but we also know that if we want our allies to step up to the plate on LGBT issues, we have to be prepared to step up to the plate on the issues that are important to our friends and allies. One of the organizations that we have been so proud to work with in building that collaboration is the National Hispanic Council on Aging. NHCOA has become a trusted friend, a reliable ally, really an extraordinary partner for SAGE.